Hi, so my name is June Goldberg and I'm doing HIV and AIDS. So, human immunodeficiency virus, or HIV, is one of the most deadly and oldest epidemics in human history. The virus works by attacking immune cells and makes patients vulnerable to comorbidities. HIV is found in infected bodily fluid, like blood or semen, and transmission occurs through unprotected sex and sharing needles. And we just have a figure here. So, untreated HIV progresses in 3 phases. The first is acute HIV infection. In the first phase, patients develop flu-like symptoms, like fevers, migraines, and rashes about 2 to 4 weeks after infection. Inside the body, HIV is spreading and killing something called CD4 cells that are meant to attack disease, and there's a very high chance of spreading HIV to others during this phase. In the second phase, chronic HIV infection, symptoms taper off and HIV cells slow their spread. Medication, ART, antiretroviral therapy, keeps HIV-positive individuals' viral loads low and raises their CD4 count. However, skipping medication weakens the immune system and allows the viral load to be too high. Treatment. If a patient takes ART as directed, they will have under 200 copies of HIV cells per 1 milliliter of blood. They keep up with their medication, patients remain in phase 2 for multiple decades and lead relatively healthy and normal lives. If HIV is left for too long with no medication, it turns into AIDS, acquired immunodeficiency syndrome. HIV can usually be left untreated for 10 years before it becomes AIDS. Once a patient does have AIDS, they survive for around 3 years. AIDS patients have weak immune systems, and they can't protect against opportunistic infections, diseases that target people with weak immune systems more than the general population. So for risk factors, poverty is the biggest risk factor for contracting HIV. Low-income individuals have higher risks for substance abuse issues, which lead to the spread of HIV because of intravenous drug use and unprotected sex. Person's home life also has an effect. Having a home is the biggest predictor that a patient can keep up with medication. Homelessness also poses a risk. AIDS has a large stigma associated with it, and since its discovery 40 years ago, it has been blamed on the gay community and drug users. Poverty can lead to risks like having unprotected sex for money, and lack of healthy food makes it harder for the body to fight a disease. Prevention of HIV and AIDS must be done by educating the public. Free testing and contraceptives prevent spread of HIV, as well as programs that give out clean needles. PrEP is a medication that reduces the risk of becoming HIV positive by about 90% and reduces the risk of getting HIV from needles by about 70%. When taken as directed, PrEP is likely to protect individuals from the disease. Substance abuse treatment for drug users also greatly helps reduce spread. So, for incidence, HIV and AIDS is most prevalent in Africa, particularly in the south of the continent. South Africa, Lesotho, Eswatini, and Botswana are the countries with the highest incidence, with the Americas following. Worldwide, there are about 38 million people, including 1.8 million children with HIV/AIDS as of 2019. The groups in the U.S. with the highest incidence of HIV are Black Americans and the LGBT community. Concerning gay youth in particular, those who experience family rejection are 3.4 times more likely to engage in unprotected sex. There is some exciting news. Thanks to advanced science, 2 individuals have been functionally cured of HIV by getting bone marrow transplants with an infusion of fresh CD4 cells that cannot be infected with HIV cells. However, this is in the very early stages, and it'll be a long time before this is available to the general public. But here is a graph of the incidence, and these are my references. So I'm just going to take a little bit of time to go through my figures. This first one is the difference between male-to-male sexual contact and drug use and the incidence of those. And this is HIV/AIDS deaths that are averted due to ART. And this is just some things that can prevent HIV infections. So, thank you.